My name is Alexandria Rocha, and today I'll be discussing cholera. Within these slides contains pathogen, transmission, symptoms, diagnosis, treatment, demographic, and AI contributions relating to cholera. Pathogen. Cholera is a gram-negative bacterium called Vibrio cholera. Cholera bacteria attacks the host intestinal epithelial cells of the small intestine. Within the cell, cholera toxins binds to its B subunits to the cell's GM1, bypassing the Golgi apparatus, eventually reaching the ER. Transmission. Cholera works by intoxication of its host. A host must ingest contaminated food or water source to get infected. The bacteria thrives in warm, alkaline, and saline conditions. It also survives favorably in water for a very long time. There are no animal hosts, rather the bacteria spreads through the animal hosts as a means of travel, where the animal ingests water or food contaminated and it passes it to another area with their feces. Not knowing they are infected, the individual stools can still share the bacteria and infect others. Bacteria for cholera can stay in an infected stool sample from 7 to 14 days. There have been cases of cholera bacteria attaching itself to shells of crab, shrimp, and other shellfish that contain chitin, and infecting humans as a result of eating contaminated or undercooked. Viable bacteria can survive well outside of the host body, especially in water. This slide continues on from transmission, except it discusses the prevention measures taken to avoid it being infected with cholera. There are 5 basic steps that the Center for Disease Control and Prevention recommends for cholera prevention. The first step includes using safe water for basic tasks like brushing teeth or preparing food. If safe water is not available, then treating the water with bleach, a filter, or boiling it should make it safe to drink. The next step is to wash hands often with soap and water. Again, if the soap is not available, then using 60% alcohol-based hand rub will help just as well. The third step encourages people to use toilets. If toilets are not available, then it is encouraged to practice defecating at least 30 meters away from any water source and to then bury the feces to prevent contamination. The fourth step mentions only using fruits and vegetables that are able to be peeled and to fully cook shellfish for consumption. The fifth and final step is more encouragement to clean up and wipe down surfaces that people frequent like food preparation and restroom areas. Areas designated for washing clothes or bathing should be down also 30 meters away from drinking water sources. Symptoms. Those infected with cholera might not show symptoms right away. Within a few days, the infected begin vomiting and defecating violently. Cholera is commonly associated with mild to severe diarrhea. With the constant vomiting and diarrhea, intestinal contents are lost immediately. Dehydration develops within hours of symptoms with the constant loss of fluids. Severe hydration is represented by a 10% loss or more of body weight. In extreme cases, cholera causes fluid loss of 1 liter per hour, reaching dangerous levels to where patients may lose 50% of their body weight during the duration of the treatment. Dehydration eventually leads to the loss of essential minerals in the blood, which creates an imbalance in maintaining body fluid balance. Due to the loss of blood volume in the body caused by dehydration, blood pressure and oxygen levels in the body drop, which results in the patient going into panic. These severe symptoms can happen within 18 to 24 hours of being infected. Untreated cholera can be fatal, with death occurring less than 2 days. The mortality rate for cholera ranges from 55% to 70%. Usually when patients recover, there are no long-term symptoms. Effects of cholera. Anyone can get cholera if they are exposed, but there are specific factors that make one more susceptible to catching it. Cholera thrives in unsanitary conditions, common in refugee camps, impoverished countries, or areas affected by war, famine, or natural disasters. Interestingly, those with type O blood are twice as likely to develop cholera compared to different blood types. In the United States, cases of cholera are very low, about 0 to 5 cases per year. Compared globally, cholera is a larger issue. Regions like Africa, Asia, and Latin America report an estimated 1.2 million people get cholera, and over 5,600 die from it in a poll done in 2017. Every year, worldwide, it is estimated that 1.3 to 4 million people get cholera, and 2,100 to 143,000 of those cases are fatal. The World Health Organization believes these numbers to be higher due to undocumented cases. Treatment options for cholera. Many patients are treated with ORS, which is an oral rehydration solution, meaning they can drink their solution rather than using an IV drip. For those so severely dehydrated that they are unable to drink, IVs are required. But as soon as the patient is well enough, ORS is used to finish treatment. The solution is a mixture of electrolyte sodium chloride, potassium chloride, sodium bicarbonate, and sucrose or glucose. This solution is administered at 100 to 400 milliliters per hour and can bring a patient back from the brink of death within about 4 hours depending on the severity of their condition. For severely ill patients, antibiotics can be prescribed along with rehydration therapy. Dioxazine is the first line of treatment for those with cholera. Specifically with children, zinc treatment has also been shown to reduce diarrheal symptoms and stool volume by 10%. During trials, children between the ages of 3 to 14 years of age showed an 8-hour decrease in symptoms after receiving zinc supplements. The diagnosis of cholera. Symptoms alone cannot guarantee a patient has cholera. Lab testing is done on stool samples. For areas where lab testing is unavailable, the Crystal VC rapid diagnosis test procedure is available. There are 2 different ways the stool is tested during this procedure. The direct test is when the watery stool itself is tested and results are reported immediately, within about 15 minutes. The issue with direct testing is that sometimes false positives are given. With an enrichment test, the stool sample is put into an alkaline peptide water and incubated for 6 hours, then the solution is tested. The results from this test are more reliable, but it does take a few hours to get completed. Contributions to help with the cholera epidemic. To determine the relationship between cholera risk and climate change, a system was developed to estimate the probability of cholera case frequency. Between 2010 to 2016, half of the worldwide cholera cases were around the northern Indian Ocean as reported by the World Health Organization. Bangladesh and India are heavily populated with about 35 to 200 million people and have a frequent history of cholera outbreaks. Programs that track the case of cholera in these countries, the International Center for Diarrheal Disease Research in Bangladesh and the Integrate Disease Surveillance Program in India, the system was able to predict with 89.5% accuracy of cholera outbreaks from records used from 2010 to 2018 database. Thank you for listening to my presentation.